Let me ask you something to start. What is the first thing you do in the morning? Not the first thing you intend to do, the first thing that actually happens. For most people, it involves a phone or an alarm or both. Eyes open in a room that is probably either too dark or too bright. A few moments of that particular morning confusion where the world has not quite come into focus yet. And then, at some point, coffee or tea or nothing at all until much later, when the day has already started and the body has been running on empty for hours. The morning routine is one of the most consistent things in most people's lives, and yet it is also one of the most nutritionally neglected windows of the day, particularly for the eyes. I want to talk to you today about what happens inside your eyes during the overnight hours and in the first hour after waking. And I want to show you that a very simple morning drink, something that takes under 2 minutes to prepare and costs almost nothing, can meaningfully support the biological systems your eyes depend on for clarity, hydration, and long-term health. This is not about a miracle cure. It is not about reversing decades of change overnight. It is about understanding what your eyes actually need in the morning and giving them that, consistently, every day, in a way that compounds over weeks and months into something genuinely meaningful. Before I describe the drink, I need to walk you through the biology, because the recommendation only makes full sense once you understand the mechanisms behind it. And once you understand those mechanisms, you will see why the specific combination I am going to describe is not arbitrary. Every component is doing something specific and purposeful for your eyes. Let us start with what happens to the eye as we age. Specifically, the nutritional changes that are happening in the background, largely invisibly, over the course of years and decades. The retina, the light-sensitive tissue lining the back of the eye that converts incoming light into the neural signals your brain reads as vision, is one of the most metabolically active tissues in the human body. It consumes oxygen and nutrients at an extraordinary rate relative to its size, and it depends on a continuous supply of specific compounds to maintain the photoreceptor cells that do the work of vision, to repair the oxidative damage that accumulates with every photon of light it processes, and to maintain the optical clarity of the structures in front of it. The two nutrients most central to retinal health and most consistently insufficient in the diets of older adults in Western countries are lutein and zeaxanthin. These are carotenoid pigments, and they are the primary constituents of the macular pigment, the yellow filter that sits in the center of the retina, over the macula, and protects the most critical photoreceptor cells from oxidative and phototoxic damage. Lutein and zeaxanthin cannot be produced by the body. They must come from food, specifically from dark leafy greens, colorful vegetables, and certain fruits. And the dietary intake of these compounds in most older adults is well below what research suggests is needed to maintain adequate macular pigment density. The consequences of insufficient lutein and zeaxanthin are not dramatic or sudden. They accumulate slowly. The macular pigment thins. The photoreceptors beneath it receive more oxidative stress than the body can adequately neutralize. Contrast sensitivity declines. Glare becomes more bothersome. Color vision becomes slightly less vivid. And the risk of age-related macular degeneration, the leading cause of irreversible central vision loss in adults over 50, rises in proportion to how depleted the macular pigment has become. The Age-Related Eye Disease Study, AREDS 2, one of the most significant clinical trials in ophthalmic nutrition, found that supplementation with lutein and zeaxanthin significantly reduced the risk of progression to advanced age-related macular degeneration in people already showing early signs of the disease. The effect was meaningful and consistent enough that the American Academy of Ophthalmology now recommends these nutrients as part of the management approach for intermediate AMD. But you do not need an AMD diagnosis for this to be relevant to you. The macular pigment begins thinning decades before any clinical diagnosis is made. Supporting it nutritionally is a long-game strategy, one that is most effective when started early and maintained consistently. Beyond lutein and zeaxanthin, vitamin C is a nutrient that the eye concentrates at remarkable levels, The aqueous humor, the fluid inside the front chamber of the eye, contains vitamin C at concentrations 15 to 20 times higher than in blood plasma. This extraordinary concentration is not accidental. Vitamin C is one of the primary antioxidant defenses protecting the lens, the clear, flexible structure that focuses images onto the retina, from the oxidative damage that leads to cataract formation. The lens is particularly vulnerable to oxidative stress because it has no direct blood supply and relies on diffusion for nutrient delivery. Maintaining high vitamin C levels in the eye's fluid environment is one of the ways the body protects the lens from clouding over time. Vitamin C levels in the eye fall when plasma vitamin C falls, which happens overnight during sleep, when you have been fasting for 6 to 8 hours and your last dietary intake of vitamin C was the previous evening. The first thing in the morning is therefore the lowest point of your daily vitamin C cycle from the eye's perspective. Replenishing it early in the day, before significant light exposure begins and the oxidative demands on the lens and retina start accumulating, is biologically well-timed. And then there is omega-3 fatty acids, specifically DHA, docosahexaenoic acid, which is a structural component of the photoreceptor cell membranes in the retina. DHA makes up approximately 30 to 40% of the fatty acid content of the rod and cone outer segments, the parts of the photoreceptors that actually capture light. Without adequate DHA, these membranes become less fluid and less functional, impairing the photochemical reactions that translate light into neural signals. DHA also plays a role in the resolution of inflammation in the retina, producing specialized pro-resolving mediators called neuroprotectins that help resolve inflammatory processes before they cause lasting damage to retinal tissue. Low omega-3 status is associated in epidemiological research with higher rates of dry eye syndrome, reduced macular pigment density, and increased risk of age-related macular degeneration. Now, the hydration dimension. This is the part of the morning eye health story that almost nobody discusses, and it deserves serious attention. The tear film, the thin fluid layer that coats the surface of the eye with every blink, is not simply water. It is a complex, three-layered structure. The innermost layer is a mucin layer produced by goblet cells in the conjunctiva that allows the tear film to spread evenly across the eye surface. The middle layer is an aqueous layer, predominantly water, containing electrolytes, enzymes, and immunoglobulins. The outermost layer is a lipid layer produced by the meibomian glands along the eyelid margins, which prevents evaporation of the aqueous layer. This tear film is essential not just for comfort, but for visual acuity. The tear film is actually part of the optical system of the eye. It forms the first refractive surface that incoming light encounters. An irregular, thin, or unstable tear film produces optical aberrations that reduce the sharpness of vision before light has even reached the lens or the retina. The blurriness that many people experience first thing in the morning, that frustrating period where vision takes several minutes to settle, is in significant part a tear film phenomenon. The tear film has thinned overnight, the ocular surface has dried, and the optical surface of the eye is irregular until the tear film is restored through blinking. Overnight, the body loses water through respiration and perspiration. Estimates suggest half a liter to a liter of water is lost during a typical night's sleep. The tear film and the ocular surface share in that dehydration. By morning, the aqueous component of the tear film is depleted, and the ocular surface is in its driest state of the day. Rehydration in the morning is therefore directly relevant to eye comfort and early morning visual clarity. But hydration with plain water, while valuable, does not address all of the components involved in tear film quality. The aqueous layer of the tear film contains electrolytes, sodium, potassium, calcium, magnesium, that are involved in osmotic balance. Replenishing water alongside electrolyte support produces better tear film restoration than water alone. And here is where the morning drink comes together. Because each component in the combination I am going to describe addresses one of the specific biological needs I have just outlined. Warm water with fresh lemon juice and a small amount of ground flaxseed or chia seeds. That is the drink. Let me tell you exactly what each component is doing. The warm water is the hydration foundation. Warm rather than cold for two reasons. First, warm water is absorbed slightly faster from the stomach than cold water, meaning the hydration reaches your tissues, including the tear film, more quickly. Second, warm water supports the flow of the meibomian gland secretions along the eyelid margins that produce the lipid layer of the tear film. The meibomian glands produce an oily secretion called meibum, and like most lipid secretions, meibum flows more freely when warm. People who suffer from meibomian gland dysfunction, a leading cause of evaporative dry eye, are often advised to apply warm compresses to the eyelids for this reason. A warm drink in the morning provides a gentle internal warming effect that complements that process. The fresh lemon juice provides vitamin C. 1 tablespoon of fresh lemon juice, approximately 15 milliliters, contains approximately 8 milligrams of vitamin C. That is modest on its own, but in the context of the morning low point of vitamin C that I described, it provides an early replenishment of the antioxidant the eye's fluid environment is waiting for. It also provides flavonoids, particularly hesperidin and eriocitrin, that have documented anti-inflammatory effects on ocular surface tissue and that support the vascular integrity of the tiny capillaries supplying the retina. The citric acid in lemon juice also stimulates saliva production, which is a minor point, but one that reflects broader digestive readiness for the nutrient absorption that follows breakfast. 1 tablespoon of freshly squeezed lemon juice is the right amount, not bottled lemon juice, which often has the flavonoid content diminished through processing. Fresh, squeezed directly into the warm water. The ground flaxseed or chia seeds, 1 tablespoon stirred into the drink, provides the omega-3 component. Both flaxseed and chia seeds are among the richest plant sources of alpha-linolenic acid, ALA, the plant form omega-3 that the body can partially convert to EPA and DHA. The conversion rate is not efficient. Typically somewhere between 5 and 15% of ALA is converted to the longer chain forms that the retina specifically needs. But in the context of a daily habit maintained consistently, this conversion contributes meaningfully to the omega-3 status that supports retinal membrane integrity, tear film lipid quality, and the anti-inflammatory environment of the ocular surface. There is an additional benefit of ground flaxseed that is particularly relevant to dry eye. Several clinical trials, including a randomized controlled trial published in the journal Cornea, have found that flaxseed oil supplementation significantly reduced dry eye symptoms and improved tear film stability in patients with dry eye syndrome. The mechanism involves both the systemic omega-3 effect on ocular surface inflammation and the specific fatty acid composition of the meibomian gland secretions, which is influenced by dietary fat intake. When dietary omega-3 intake is adequate, the meibum produced by the meibomian glands is more fluid and more effective at preventing evaporative tear loss. Ground rather than whole seeds is important. The tough outer hull of whole flaxseed and chia seed passes largely undigested, limiting absorption of the omega-3 content. Ground seeds, where the hull is broken, release the oils for absorption. You can buy pre-ground flaxseed, also called flaxseed meal, or grind whole seeds yourself in a coffee grinder. Store ground flaxseed in the refrigerator because the omega-3 oils oxidize quickly at room temperature. Chia seeds are softer and do not require grinding. They can be stirred into the drink as whole seeds or soaked briefly in the warm water, where they will swell and release their mucilage, which has its own beneficial effects on gut health. The drink is warm water, approximately 250 to 300 milliliters, with 1 tablespoon of fresh lemon juice and 1 tablespoon of ground flaxseed or chia seeds. Stir well. Drink it within the first 30 minutes of waking, before breakfast, before coffee, before anything else. The fasted state of the morning means that the nutrients in this drink, the vitamin C, the ALA, the flavonoids, are absorbed without competition from other foods. The early timing ensures that the antioxidant replenishment reaches the eye's fluid environment before the oxidative demands of the day begin accumulating. Let me now address the blood flow dimension, because this is a part of eye health that does not receive enough attention in general health conversations. The retina is supplied by the central retinal artery, which enters the eye through the optic nerve. The health and responsiveness of this blood supply, and of the tiny capillaries that branch from it across the retinal surface, directly determines how well the retina receives the oxygen and nutrients it needs for its extraordinary metabolic demands. Impaired retinal blood flow is associated with increased risk of a range of eye conditions, including glaucoma, diabetic retinopathy, and age-related macular degeneration. And retinal blood flow tends to be at its lowest point in the morning, partly because blood pressure and cardiac output are naturally lower during sleep and in the immediate post-waking period, and partly because the mild dehydration of overnight fasting reduces plasma volume slightly. The morning drink supports retinal blood flow through two complementary mechanisms. The vitamin C and flavonoids in lemon juice support endothelial function, the health and responsiveness of the blood vessel walls, by supporting nitric oxide production and reducing oxidative stress in vascular tissue. Adequate nitric oxide is what allows blood vessels to dilate appropriately in response to demand. And rehydration with warm water restores the plasma volume and reduces blood viscosity that morning dehydration has temporarily affected, improving the fluidity and microcirculation that the retinal capillaries depend on. These are not dramatic, acute effects. They are the kind of consistent daily support that maintains vascular health over time, rather than producing a noticeable change on any given morning. But maintained consistently over months and years, adequate retinal blood flow is one of the most important factors in preserving the health of the photoreceptors and the nerve fibers that carry visual information from the eye to the brain. Now let me talk about what you eat at breakfast, because the morning drink is most effective when followed by a breakfast that continues the nutritional support for eye health rather than working against it. The most eye-supportive breakfast pairings build on the foundation the morning drink provides. Eggs are at the top of this list. Whole eggs contain lutein and zeaxanthin in a highly bioavailable form. The yolk-based lutein and zeaxanthin in eggs is absorbed significantly more efficiently than lutein and zeaxanthin from most plant sources, because the fat in the yolk facilitates carotenoid absorption. 1 or 2 eggs, soft scrambled or soft boiled, to preserve the heat-sensitive nutrients in the yolk, provide a meaningful contribution to the macular pigment replenishment that the eyes need daily. Dark leafy greens alongside the eggs, a handful of wilted spinach or kale, add the plant-based lutein that complements zeaxanthin in building the macular pigment. The fat from the egg yolk present in the same meal improves absorption of the carotenoids from the greens. This is one of the most nutritionally efficient breakfast combinations for eye health. Eggs and leafy greens together, where the fat from one improves absorption from the other. A small amount of smoked salmon alongside or instead of the eggs provides DHA in its preformed marine omega-3 form, more efficiently absorbed than the ALA in flaxseed, and a direct contribution to the photoreceptor membrane integrity that the morning drink's flaxseed component supports. 2 to 3 ounces of smoked salmon with eggs on whole grain toast is a breakfast that covers the omega-3, the carotenoids, and the protein needs for eye health comprehensively. For people who prefer a non-animal-based breakfast, a bowl of oatmeal with a small handful of goji berries, which are one of the highest dietary sources of zeaxanthin, alongside a tablespoon of ground flaxseed and some blueberries, provides a plant-based equivalent. The goji berries contribute zeaxanthin and beta-carotene. The blueberries provide anthocyanins that support retinal blood vessel health. The flaxseed adds further omega-3. And if you add a tablespoon of chia seeds or hemp seeds, you have a breakfast that is doing serious nutritional work for your eyes without any animal products. What to avoid at breakfast from an eye health perspective is less about specific foods and more about what displaces the nutritional content I have described. A breakfast of pastries, sugary cereals, or white toast with jam provides almost nothing for the eye's nutritional needs, while producing the blood sugar elevation and inflammatory response that actively works against vascular health in the retina. This is particularly relevant for anyone managing diabetes or insulin resistance. Retinal vascular health is one of the first things to be compromised by poorly managed blood glucose, and the morning meal is one of the most important opportunities to set the glycemic tone for the day. Let me bring all of this together with a practical picture of what this morning routine actually looks like, because I want you to leave this video with something you can implement tomorrow morning, not a complex protocol that requires significant lifestyle disruption. You wake up. Before coffee, before your phone, before anything else, you prepare the morning drink. Warm water, not boiling, just comfortably warm. 1 tablespoon of fresh lemon juice squeezed directly in. 1 tablespoon of ground flaxseed or chia seeds stirred in. You drink it over the next 10 to 15 minutes while you are getting ready for the day. At breakfast, you eat eggs, soft scrambled or soft boiled, with a handful of spinach or kale, or oatmeal with goji berries and blueberries, or smoked salmon with eggs and whole grain toast. You add color where you can, a few cherry tomatoes, some sliced bell pepper, a handful of berries. That is it. That is the entire morning routine. It takes under 5 minutes of additional preparation. It costs a few dollars per week, and it addresses directly and specifically the 4 biological needs that morning eye health depends on. Rehydration of the tear film and ocular surface, vitamin C replenishment for lens protection and retinal vascular health, omega-3 support for photoreceptor membrane integrity and tear film lipid quality, and carotenoid provision for macular pigment maintenance. None of this is dramatic. None of it will produce a noticeable change tomorrow morning. What it produces, through consistency, through daily deposits into the nutritional account that your eyes draw on, is a meaningful difference in the trajectory of your eye health over the months and years ahead. Less morning dryness, better tear film stability, maintained macular pigment density, reduced oxidative stress on the lens, better retinal blood flow. The eyes are not passive structures that simply deteriorate with age, regardless of how you care for them. They are living, metabolically active tissues that respond to how they are nourished. The morning is the window when they are most depleted, most in need of replenishment, and most receptive to what you give them. Give them what they need. Every morning. Consistently. And they will carry you, clearly, comfortably, reliably, for far longer than if you do not. A final word before I close. Everything I have described today is nutritional support for eye health in adults without serious diagnosed eye disease. If you have been diagnosed with age-related macular degeneration, glaucoma, diabetic retinopathy, or any other significant eye condition, please continue following the guidance of your ophthalmologist and bring any dietary changes to their attention. Nutritional support works alongside medical care. It does not replace it. And regardless of your current eye health status, if you are over 50 and have not had a comprehensive eye examination in the past 2 years, please book one. Many of the conditions that affect vision in older adults, including early macular degeneration and glaucoma, develop silently, without obvious symptoms, until they have progressed significantly. Early detection changes outcomes in ways that late detection cannot. If this was useful to you, please subscribe to the channel and share it with someone in your life who is noticing changes in their vision and looking for practical ways to support their eye health naturally. Leave a comment below. I want to know whether you experience morning eye dryness or that frustrating period where vision takes time to settle after waking. Your responses help me understand what this community needs most. In the next video, I will be talking about the bedtime drink that research links to reduced dry eye symptoms and improved morning visual clarity, something that works alongside the morning routine we discussed today to support your eyes through the overnight repair window as well. I am Dr. Julian Cross. Take care of yourselves, and I will see you in the next one.